So let's break down heart sounds with a simple mnemonic. So, some say silent. S1 is so. That's when the mitral and tricuspid valves close, marking the start of systole. Next, we have S2, some. The aortic and pulmonary valves close, signaling the stop of systole. Then comes S3, say. That's the sloshing in during early diastole. Normal for the young, but a red flag for adults. Finally, S4 is silent, indicating a stiff wall during late diastole as the atrium contracts into a stiff ventricle. And remember, lub-dub helps too. Lub is S1 and dub is S2. For a bonus, think try my apple pie for valve closure, tricuspid and mitral for S1, aortic and pulmonary for S2.